Okay, thanks again for staying with us on the program TMI Monday. Of course, we're doing this just for many of us to appreciate the seriousness of what we're talking about. I know that in recent times there's been a concerted effort in the direction of ensuring that there is compliance to the use of face masks. I recall that on Saturday, I saw members of the task force stopping and searching and ensuring that people use face masks. It's for your own benefit and it's for your own good. Well, just because I need to communicate properly, we have in the studio members of the Nigerian Medical Association. Incidentally, of course, are medical practitioners. They're here specifically just to give us insights into some of the things that we're seeing happening as it relates to COVID-19 pandemic. One thing is clear, is the fact that the numbers keep rising by the day. This morning, reflecting on yesterday, we had a total number of 86 new confirmed cases of COVID-19. And altogether, we have a total of 627 cases confirmed, 170 cases have been discharged, 21 deaths have been recorded in Nigeria. So if you go straight to the NSCDC portal, you find this information there. Let me welcome Dr. Valentine Omofo, the State NMA Chairman, and of course Dr. Harrison Omohua, the State Deputy Chairman. Gentlemen, once again, thank you for coming on the program.
My pleasure.
Okay, I want to ask this question. Was this anticipated? Was it anticipated that these numbers will continually rise like we're seeing today, or there are factors, circumstances and situations that is responsible for this upsurge in the numbers?
Well, actually, scientifically, when there's an epidemic like this, it is expected that there should be a geometric rise, initially. We had importation of the disease, and then of course you have community spread. It's expected naturally that there should be, a high increase, and then as the population tend to put in mechanisms to curtail it, as people tend to obey this, people get well, we now expect it to start to, to drop.
Okay, Doc, you have some perspectives on that too.
Well, yes, like the chairman has rightly said, is what we are witnessing just now is a community spread, apparently. And in addition to that, you find out that the number of test centers have increased. So more people are being tested. So it's not a surprise that we are seeing more cases. It will rise, but then it will eventually drop.
Okay, let's look at the issue of some of the issues that have been raised in recent times about COVID-19. Some academicians, some professionals have expressed their views about the true nature of the virus itself, whether it's a living thing, whether it's a not living thing. As a medical practitioner, what are your thoughts along those lines?
Well, thank you very much, Sonny Duke. You see, one thing that is very, very interesting about science, is there for everybody to see, it's there for everybody to prove. The facts are clear in science. Whatever you do in science, you must show it to your colleagues. There must be peer review. Everybody must agree, on the situation and what is on ground. It's basic medical students, training. We know the viruses, they are a link between living and non-living organisms, because they share the characteristics of both. We all know that viruses on their own may not be able to carry out these functions or replicate. They could appear as inanimate objects in the surroundings. But when they get into a living host, naturally they seize the machinery of this living host to begin to replicate, to carry out all the functions that they were not able to carry out hitherto while, in isolation, so to speak. So they in some instances, they can be classified as non-living, in others, they are living. But it is clear that viruses can cause infection, when they gain entry into a host. They utilize your own cellular mechanisms to continue to multiply, and then they spread and damage your tissues.
Dr. Harrison, is COVID-19 the virus responsible, would you say, is living or is non-living?
Well, the COVID-19 disease or the disease it shares the characteristics of both living and non-living. But for somebody to entirely say it's non-living, I don't think it's correct, because there are certain characteristics, features of the virus or viruses generally that have both living and non-living.
So what are those characteristics that makes it living, and what are those characteristics that makes it not living in case of COVID-19? Dr. Mohwa.
So, for instance, like the chairman has said, it can't on its own move from one place to another. It needs a vehicle.
Okay.
And this time, it gets the vehicle or the carrier is incidentally the living thing, the human being.
Okay.
Most times, maybe some other times, animals or pets or something like that.
Okay.
But so this time it has. So you can say it's unable to move from one place to another without at least. Except for the help or assistance of a carrier also. And then living in the sense that when it gets into the host or the carrier, it starts to perform or start to destroy certain vital organs in the body. And so it's beginning to show some living features.
Okay. Doctor, you want to add something to that?
Another major characteristic of living organisms that it doesn't display on its own is reproduction, multiplication. You know, like has been adduced severally. If a virus, you know, is outside a living organism, it cannot usually multiply on its own. But when it's already into cell lines, when it gets into a host, an animal, a human being, it takes over your own cellular mechanism because it lacks some of those cellular mechanisms to carry out these functions. It takes over your cellular mechanism and it begins to actively multiply itself into thousands of its own type. So that ability to self-multiply, reproduce yourself, is a key characteristic of living organisms, which the virus begins to now display once it's inside a living host.
Okay. Let's talk about, because it's been called or classified as novel coronavirus. In that sense, what is the capacity of our medical practitioners to effectively and efficiently handle this virus? And then again, recently we saw the arrival of some health practitioners from China to Nigeria, which of course caused a bit of uproar at the onset, but eventually they came. So I'd like to get your thoughts along those lines.
Yeah, thank you very much. That is another very contentious area. You see, like it's a novel virus worldwide. What that means is coronaviruses have always been there, but this particular one has some modification from the previous ones. In that sense, it will have some different characteristics by way of causing infection, infectivity. This is a much more easily transmitted virus than the previous ones, you know, and so that makes it its damage, you know, worse in the community. Now, having said that, nobody has all the answers. Even in China, where it originated, it killed many people. The world, the medical world, is still trying to evolve, still trying to understand this virus. That is why as of today, there's no known cure. Everybody is still trying out his model to see what is working and what doesn't work. At the same time, the studies are ongoing. So no one country can tell you that they have a cure for this virus. Scientists over the world are exchanging ideas. What have you done? What has worked for you? And people are beginning to try out these models. So hopefully we are learning every day. And funny enough, I think we are doing very well in Nigeria because fertility rates are quite low compared to some of the other countries. Although we know there are so many other factors involved, which we are actually trying to discern. But having said that, the about the Chinese, to me, the main problem I saw was the way it was handled. Government wasn't very, very open and clear about, you know, what was happening. If we knew what we were coming to do, it might be viewed differently. We just heard that Chinese doctors are coming to help in the fight against COVID-19, and thereafter, when NMA shows some resistance, because we know there are laws governing medical practice. The next thing we heard was the company now addressing Nigerians that they are bringing these people to help us and then to treat their staff. You know, we know that was not very comfortable. no country refuses help because countries are supposed to watch out for each other. It's natural to give medical help whatsoever to fellow countries. But the aspect of them coming to treat their staff, their citizens who work here, was totally absurd to us. Because I can't leave here and go to America to go and treat Nigerians who are working in America. I need to have been certified by that country's medical board that I'm actually a doctor. They need to see my credentials, make sure I'm certified. This was not even anticipated in Nigeria. So that is why, and we looked at the world politics. We hear that many countries have ejected products from China in the recent past, because of standard. Even face masks that have gone to Europe were returned. Some people claim that they had test machines that were tinted with the virus. So there's a lot of suspicion. We didn't feel that was the right time for Nigeria to be accepting these things from China, without proper scrutiny and proper, arrangement to verify what was happening. That was why the NMA was apprehensive. And even though the government insisted, we believe in the NMA that consultation is not always the best way to handle issues. We've set guidelines. These people must be quarantined, they must be tested. And the things they are brought, for the country must obviously be tested and certified before they are used. If it comes to the idea of them coming to treat people, then they have to go through the hurdle. They have to be certified properly by the Medical and Dental Council that these people are actually trained personnel, and they are fit and certified to practice in Nigeria.
Okay. If you just join us, it's TMI Monday with yours sincerely, Sonny Duke Okosun, explaining all the different shades, all the different issues surrounding COVID-19 pandemic, both locally and nationally, as well as internationally, just for you to make sense of it all. Let's quickly conclude on this. In Edo State, several efforts are being put together just to see how the spread can be contained. Let me get from Dr. Harrison Mohwa. What are your thoughts and perspective on the efforts so far on testing, on screening, on isolation and quarantining people?
Yes, I want to say here that in the beginning, things were quite slow. As a matter of fact, the Nigerian Medical Association took it upon itself to ensure that everybody concerned in curtailing, in fighting this pandemic is up to the game. Okay. And so they took some time out to do inspection of facilities around the state. Yes, it was slow, but I think Edo State just now has done relatively well, although there's still room for improvement. But again, I want to quickly mention here that we must continue to hail, we must continue to pray for the frontliners, the healthcare workers who are continually there despite the fear, despite the scare of this virus, but they are there in the front line ensuring that those who are affected, they are well taken care of. And you can see for yourself that a few days ago or last week, those states discharged about 5 people. And again, if you follow the recent trend, you find that the testing centers have also been increased by the state government, and this is a welcome development. All right, and I think we are going there.
What do you mean we are going there?
We are going to that stage where we can say and beat our chest that we are fully prepared.
Okay, you share the same thoughts.
If I may add, like has been adduced, the state has its policies, but we in the NMA, we as partners in progress with the state government, we've always felt that there was need to improve on what was happening. For instance, we felt there was need to do more enforcement, of the government policies like social distancing, people not crowding up the environment. We saw some buses carrying so many people and all that. So we had complained, to the state government that these things needed to be checked, and we also complained that the influx of people into the state, particularly from places like Lagos and all that, we needed to check this, due influx and all that. But happily enough, the government seems to be have taken this advice, and they are on top of the game for now. We heard that the government just imposed a curfew yesterday, and he's also said that there will be scrutiny of people who come into the state. These are quite laudable measures taken by the government, and we hope people will obviously obey them. And again, that the mobile court not too long ago, because we just felt people were just walking around, flouting the rules, and these rules are not meant to be punitive, you know, and again, you can see we stepped up the level of mobilization, the news media like yourself, like we are doing here now, trying to enlighten people. Because of our people before now didn't believe there was any virus. And people also said that they said it wasn't real, it was fictitious. It is wrong about such information is that people tend to be loose. They tend to lose their guard. After all, you know, the thing doesn't even exist. But we are happy that today we are picking up, like my colleague said, our doctors are doing their best, presenting their job in this. But we shouldn't take it as a liberty to, you know, lessen our guard. If anything, we should tighten up our guard properly, because we know so many states are rising in our figures now of infected people. This is time we should be watchful. You saw the other day in Delta State, there was the lock-up at Tolobo. They were screening people who were entering the state. We should get to that level. If possible, have a screening center at the borders.
Okay.
So that we can screen those who were allowed to come in.
Okay.
Those who we find to be sick, they should be taken straight to the hospitals to be isolated or back to their states where they are coming from.
All right, let me thank you, Dr. Valentine Moifo and Dr. Omokhwa Harrison, for finding time to be with us on the program, and also join forces to educate and enlighten members of the public there on the realities of COVID-19 pandemic. Once again, thank you for coming.
Thank you so much.
We'll take a short break. When we return, we'll look at some of the key issues that is at the front burner from the broadcast by the state governor yesterday on Edo State level of response to COVID-19 pandemic. Once again, thank you for staying with me on TMI Monday.